Hello everyone, I'm honored to present my work here today. My name is Huang, and I'm an undergraduate student from the National University of Malaysia. Today I will be presenting my study on the effect of combined cognitive behavioral therapy and exercise prescription on the physical and mental health of highly academically stressed adolescents. I will divide my presentation into 4 parts. Part 1, research background. Part 2, research problem. Part 3, research method. Part 4, conclusion and outlook. Okay, let's begin part 1, research background. Part 1, I will talk about common social issues, known benefits of sport activities, limitation of existing intervention measures, and theoretical gaps and innovation opportunities. Firstly, common social issues. Teenagers face enormous academic pressure for a long time, which makes them susceptible to the effects of chronic stress. The high-intensity academic pressure also leads to the problem of insufficient physical activity among teenagers. Then I want to share known benefits of sports activities. Numerous studies have consistently shown that regular physical activity has multiple positive effects on enhancing cognitive function and promoting metabolic health. Aerobic exercise such as running and cycling and resistance training such as strength exercise have been proven to significantly improve executive function in the brain, including attention and working memory, while also helping to enhance emotional stability and stress resistance. At the physiological level, these two forms of exercise can also optimize multiple cardiovascular and metabolic biomarkers such as lowering blood pressure and improving blood lipid levels. These changes not only reduce the risk of metabolic and cardiovascular diseases, but also further promote overall health and quality of life improvement. Therefore, incorporating regular exercise into daily life is considered one of the effective strategies for maintaining physical and mental health. Also, regular physical activity has broad empirical benefits for physical and mental health. Existing interventions for exercise and health still have significant design limitations. At present, most intervention programs mainly focus on examining and improving physiological outcomes, such as cardiovascular endurance, muscle strength, body composition, and other specific indicators, but fail to systematically integrate psychological promotion strategies into them. More importantly, such programs often overlook the central role of individual psychological factors such as intrinsic motivation, self-efficacy, social recognition, and psychological resistance in successfully initiating physical exercise and achieving long-term persistence. The lack of psychological support makes it difficult for many interventions to trigger and maintain individual health behavior changes, thereby limiting their potential and persistence in improving overall health outcomes. Therefore, future health interventions urgently need to shift from a simple physiological model to a comprehensive model that integrates body and mind, in order to more effectively support the establishment and maintenance of healthy behaviors throughout the entire cycle. There are significant theoretical gaps in current research on adolescent health, many reflected in the fact that existing studies mostly focus on a single dimension of psychological and the physiological health. There is still a lack of systematic exploration of the mechanism of physical and mental interaction, and its integrated application in intervention, making it difficult to meet the complex needs of adolescent groups. The dual-track intervention model combining cognitive behavioral therapy with exercise prescription provides an important innovation path to fill the theoretical gap mentioned above. It not only helps deepen the understanding of the mechanism of physical and mental coordination in therapy, but also lays the foundation for developing holistic and efficient strategies for promoting youth health in practice. Okay, part 2, I want to talk about the research program. It can be divided into two topics: the core issue addressed by this study and the specific issue addressed in this study. Extending exercise intervention for adolescents experiencing highly academic stress are overly narrow, primarily focusing on physiological benefits such as improving VO2max and increasing strength, while neglecting the integration of psychological strategies. This body-only psychology neglecting approach yields limited results. Such limitations make it difficult to develop effective programs that simultaneously improve both the physical and the psychological health of high-stress adolescents. Therefore, this study proposed and evaluates an exercise prescription program incorporating cognitive behavioral therapy, aiming to investigate whether this integrated intervention can effectively enhance the physical and psychological health levels of adolescents experiencing high academic stress. Okay, the highlights has arrived. Part 3, research method. To better understand, I have divided into 3 sections. Section 1, project design. I have decided to adopt a new approach of dual-track intervention. What is dual-track? Simply put, it means practicing both physically and mentally. We will deeply integrate cognitive behavioral therapy, such as mindfulness, breathing, self-efficacy, and social recognition into the entire exercise prescription. Next, leaders. In order to scientifically verify the effectiveness of this plan, we adopted the classic quantitative intervention study design and set up pre-test and post-test. That is to say, before the intervention begins, we will measure various physiological and psychological indicators of each student and establish a clear baseline. After the completion of the plan, we will measure again using the same method. By comparing before and after, we can clearly see to what extent this comprehensive plan can bring about changes. The intervention cycle is divided into 2 clear stages. First, 6 weeks of continuous aerobic exercise with a focus on improving cardiovascular function and elevating anxiety. Next is a 12-week muscle strength and endurance training aimed at enhancing strength, cultivating resistance and confidence. Our goal is not only to create stronger teenagers, but also to cultivate individuals who are more resilient, optimistic, and adept at coping with pressure. So focusing on the picture on the right, the core of this design is to create a healthy cycle from body and mind, based on cardiovascular function and muscle strength to enhance athlete performance, simultaneously integrating stress tolerance and psychological resilience training, strengthening the inner self and combining internal and external factors. Not only simulates exercise motivation, but also brings sustained motivation through a sense of achievement and confidence, ultimately forming a strong health loop that allows teenagers to naturally persist in exercise and achieve comprehensive improvement in their physical and mental levels. Section 2, intervention, content, and implementation. In the 6 weeks aerobic exercise intervention program, we employed a structured model training approach. Specifically, the main form of exercise is continuously training, accounting for 70% of total training amount, combined with fun intervention to balance the improvement of cardiovascular endurance and maintain participation motivation. The exercise intensity should be controlled between 60% and 80% of maximum heart rate to ensure that the training is within an effective and safe range of cardiopulmonary node. The training frequency is 5 days a week. Symmetrically with after-school times, the duration of each exercise session gradually increases from initial 25 minutes to 45 minutes in the 6th week to achieve gradual overload and physiological adaptation. In addition, this program places special emphasis on the integration of psychological aspects, incorporating psychological interventions such as mindfulness, breathing, emotional release, teamwork, and attention training during the exercise process. The aim is to promote the coordinated development of participants' physical and mental health through a dual-track approach of physical exercise and psychological adjustment. A health design framework for a 12 weeks muscle strength and endurance training program. The program is mainly based on resistance aerobic cycle, executed twice a week, with resistance training Monday and aerobic cycle Thursday at the focus. In terms of intensity control, I used a load range of 60% to 75% Vm and used the box subjective fatigue scores level 6 to 15 for real-time conscious fatigue monitoring to ensure the scientificity and safety of training. In terms of frequency and progress, the plan is divided into 3 stages: neuromuscular adaptation phase, muscle hypertrophy phase, and the neural-driven phase. Gradually increasing the training load through the principle of progressive overload. In addition, this program places special emphasis on psychological integration strategies, integrating cognitive markers, emotional separation, psychological imagery, team challenges, and gamification elements, such as mechanisms such as awarding power backs to enhance participation motivation and psychological engagement and promote a comprehensive improvement in training effectiveness. Taking 3, measurement and evaluation. This study adopted a quantitative intervention design and systematically examined the impact of cognitive behavioral exercise intervention on the physical and mental health of adolescents with high academic stress through a comparative evaluation of pre-test and post-test. Measurement and evaluation cover 3 dimensions: physiological indicators, psychological scores, and behavioral engagement. In terms of physiological measures, the study selected maximum oxygen uptake and heart rate recovery abilities as core evaluation indicators for cardiorespiratory fitness, and evaluated them through standard exercise testing. Muscle strength and endurance are quantified through multiple load tests, such as the 12 to 15 exercising levels, push-ups, and plank sports, and the box subjective fatigue scores. RPE 6 to 20 is used to monitor training intensity in real time. In terms of psychological measures, the study used the perceived stress scores and other measurements. Then let's talk about behavior and participation. The study records student attendance, training compilation, and subjective psychologues, and analyzes their willingness to exercise and the degree of behavioral changes through a comparison of questionnaires before and after. The last part 4, finally, I would like to talk about the conclusion and outlook. Looking at this figure again, this shows the positive cycle of physical fitness and health, and adaptively also involves these physiological and psychological bidirectional interaction models. Below, we can review and summarize these positive impacts. In summary, these positive effects manifest at the physiological level, where regular exercise effectively enhances maximum oxygen uptake, increases muscle strength and muscular endurance, improves neuromuscular control, and boosts metabolic efficiency. At the same time, at the psychological level, exercise helps alleviate symptoms of anxiety and depression while further fostering team spirit, strengthening self-efficacy, enhancing social recognition, and stimulating intrinsic motivation. Looking ahead, this study has opened multiple promising directions for future exploration with just adopting a multiple-center randomized controlled trial design in the future to further validate the effectiveness and the reliabilities of our model using more rigorous methods. Specifically, future research should focus on verifying three core levels. I think, firstly, the universality of a model requires exploring whether the effectiveness of this intervention model remains robust across different cultural and social backgrounds. Secondly, we urgently need to evaluate these long-term benefits and test whether the intervention effect can be stable and sustained during the growth process of adolescents by extending the follow-up time. Finally, due to the broad applicability of the model, we should expand the scope of our research and test whether the model can effectively help adolescents cope with multiple sources of stress beyond academic pressure, such as social or family stress, so they truly become a comprehensive support program. Thanks for watching.